someone is showing symptoms of a heart attack, the first thing you should do is immediately alert 911 on a cell phone so that they can go ahead and send out EMS and alert it to the problem. The next thing you should do is, if you have aspirin, let the patient take it so that it can begin to flow in their bloodstream and help their heart. Hey, Daniel, are you alright? Are you feeling okay?
I just feel weird.
When someone is showing signs of a stroke, you want to ask them to do 4 things, which are lines with the FAST acronym. The first thing is you want to check for facial droop. So I'm going to have you smile from ear to ear, and as you can see, one side is drooping a lot lower than the other. Now, the next one is A for arms. You want to have them raise both arms and see if one is wavering from the other and falling down. This one seems to be having some trouble. The next thing you want to check for is S, which stands for slurred speech, which here he is having immense trouble trying to talk to me. The next is T for time. You want to find exactly when the symptoms started so we know if we need to circulate oxygen back to the brain. When someone is in need of CPR, you must make sure that you have the correct hand placement. So where you should put your hands is in the middle of the chest, on the bottom half of the sternum, right above the chest bump. So you find the chest bump, put your hands right here, and you want to interlock the top hand with the bottom hand and get ready for chest compressions.
Before beginning infant CPR, the first thing you should do is to move the infant to a place with a hard surface such as this wooden table. And you should begin by giving CPR for 2 minutes before calling 911. Chest compressions on an infant should be about 1/3 of the depth of the chest, or 1.5 inches, at a rate of 100 to 120 times compressions per minute. Instead of using both hands, you will use 2 fingers and put them in the normal spot, which is the bottom half of the sternum or above the chest bump, and begin compressions on the baby.
When someone is in need of mouth-to-mouth breaths, you want to make sure they have the right chin placement so that the air is going directly into their lungs and filling them up. So what you do is you would take their chin and bring it as far up as possible, and then begin either mouth-to-mouth resuscitation or get a mouth mask, put it over, and then begin. When someone is choking, they are most likely in need of immediate help. So 3 ways you can make sure you can tell if they're choking is if they cannot cough, they cannot breathe, and they also cannot speak. When you see someone that is in need, that is choking and is in need of help, the first thing you should do is ask them, "Are you choking?" They will nod yes, and then you have to ask them, "I know how to help you. May I help you?" Which they should reply yes. Next, you want to go behind them and place your fist right above, find their belly button, put your fist right above their belly button, but below the xiphoid process. Then, when you're doing the compressions, you want to push up and in until either the object comes out or they go unresponsive. When someone is bleeding, the first thing you want to do is apply direct pressure with your hand to the bleeding spot. Then, you want to get a bandage and put it underneath your hand and block the blood. And then you want to wait. And if the blood is leaking through the bandage, you want to add more until it stops leaking. Then when it stops leaking, you can take some more bandage and begin to wrap around it, making sure it has tight pressure to keep that wound from pouring out more blood and leaking through the bandage. Hey, are you alright? As you can see, this patient is showing signs that he is going into shock. One really easy way to test for this is to take his hand and grab a thumbnail and hold until it turns white. Then, when you release it, it should return back to its reddish color by the time it takes you to say capillary refill. Let's say for this patient, it does not refill in time. This is a good sign that he is going into shock, and you want to immediately take some type of covering or clothing or blanket and cover him and his entire body so that it'll keep him warm, because if not, he could suffer greatly. Hey, are you alright?
I just
You
burned
burn
myself.
yourself? When someone has a burn, there are 3 steps you should take. A is to remove them from the source of the burn so that there can be no more damage. The second thing is to take a water bottle and clean it with cool, cold water. And then the third thing is when possible, take a dry, sterile bandage and wrap their wound and then take them to the hospital immediately. Hey man, are you alright? Are you okay? Are you diabetic? When a person that has diabetes is having a low sugar drop in their blood, they need more sugar so that they can become more active and their body function properly. The best way to do this is to give them a glass of orange juice or glucose in the form of tablets or gel, so that it can immediately get back into their system and get them up and running again. It takes about 15 minutes to get sugar in their body. Right now, all we have is some sugary candy, and we can give them that to last them for a short period of time. When moving someone into the recovery position, it is important to know which steps need to be taken. The first step is to take the arm closest to you and put it above their head. The second step is to take their leg furthest away and take it across the ankle like this. Now, you want to bring their head and neck up off the ground as you take their wrist and hip and bring it towards you. Now, you want to take the leg closest to you and put it as a kickstand, keeping them up from falling. Now, you want to take the hand that is having the pressure on their head and slowly relieve it as you bend their arm so that they rest. And now you want to lean them towards you so that if and when something starts to come up their throat, it can come out with ease.